Sitting is one of the most common painful positions for people with pain deep in the center of their glute. This is often diagnosed or referred to as Piriformis pain syndrome or even Deep Gluteal Syndrome. And at first thought, it's very tempting to want to try to stretch this thing with figure 4 stretches, knees to chest, all kinds of funky twists, nerve glides, leg raises, things like that. And it hurts so good in the moment, but this may actually be keeping you from healing. The reason that sitting is such an issue is due to the compression. When we compress something, we squeeze it and we reduce the blood supply to the area which is in pain. And why is this important? Because inside the blood, there are nutrients and there's oxygen, which is required for those tissues to heal. And so in this video, I'm going to share with you a 60-second exercise you can perform in your chair while you're seated to boost or maximize blood supply to the injured area of your glutes. I'm also going to share with you a simple tweak or modification to the way that you sit so that you can maintain the results that you get from the exercise that I'm about to show. And in case you're wondering who I am, my name is Dr. Charlie Johnson. I'm a physical therapist, and after reviewing over 10,000 back, butt, and sciatic pain cases, I've seen that people naturally gravitate towards stretching, pulling, poking, and prodding the area of pain, thinking it's going to help them get out of pain, but it keeps them from healing. And so in this video, I want to help you shift the way you view solving the problem so that you can get a different result. Okay, so let's dive into the exercise. So in order to perform this exercise, you need some type of resistance band. Mild to moderate resistance works probably the best. These loop bands work nice. They're just easy to put on, as you'll see in a moment, but you can also get the ones that tie. That being said, if you don't have a band, you can get creative. An old pair of shorts, an old pair of underwear, just the elastic band might work. You could try a bungee cord, a ratchet strap, an old belt. Your hands, if you've got long arms like me, anything like that that you can just push into will work or could work. Maybe you just have to think outside the box. Now, as far as the setup, so take whatever you're using for resistance, and I want you to put it or place it just above the level of the knees. So just like this. Now, the setup, so I'm going to turn to the side so you can see. So this is maybe typically how you sit, but what I'm going to have you do is I'm going to have you scoot forward, and then I'm going to have you lean back. This is going to open what we call the hip, so hip trunk angle. And then scoot your feet back and go up on your toes, that's important, and keep your heels together. And then what you're going to do is you're going to push out or provide resistance against, again, maybe it's a band, maybe it's a belt, something like that. And you're going to push, 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 and you're going to hold. The goal here is 60 seconds of hold time. More so, we just want to bring to a point of fatigue that's around that 45 to 60 second mark. And as you hold and as you provide resistance, you're going to temporarily create some squeeze in the muscles of the glutes. But what you'll notice is that the longer you hold and the harder it gets, the more blood supply that area is going to need to perform the work that you're asking it to do. As we increase the blood supply, we increase oxygen and nutrients. Unlike when we sit on a ball, when we stretch, where we reduce the blood supply and oxygen, just providing this isometric resistance, meaning we're not moving anything, we're just pushing and squeezing, will really fire up your glutes, I feel it right now, deep in the buttocks on both sides, and increase the blood supply, oxygen, and nutrients, all right? So that's one rep. Now again, you take 20, 30 seconds, you take a break, and then you go and you push again, up on your toes, keeping your heels together, and you'll feel your legs starting to shake. Now, how do you know if this is right for you? You could determine this in a couple ways. Number one, you could just sit there and say, are things same, better, worse? If your baseline sitting symptoms are better after doing this, then that's awesome. We can continue with this. You might perform, say, 3 60-second holds or 3 holds until you're tired, maybe 2, 3 times throughout the day as little micro snacks, little movement snacks throughout your work day. The other way is maybe you have a certain motion that you know is painful. So oftentimes people will find that doing this motion or doing a nerve glide or moving their body, going up the stairs is painful. So go ahead and retest that motion to see how does that feel now. So that's another way we could do it. And if it's painful while you're doing it, just know that we're going to ixnay this exercise. We're going to say that's probably not for you. And so we don't want to perform this if it's yucky. So to be clear, if as you're doing it, you're saying, that's increasing my pain, we're not going to do it. We have to go testing for other motions, other movement pills. So that's that. The second part to this is that let's just say you did that exercise and you found relief. Well, you want to maintain that relief. So we want to make sure that we're not doing something, taking a pill or a motion or a movement as medicine that helps us, and then we put ourselves in an environment which is not conducive to healing, which undoes the positive effects of that thing we just did. And so oftentimes this shows up in the way that we're sitting. Many people with piriformis syndrome, again, they have yucky figure fours, knees to chest. And this becomes an issue because unknowingly, we're often putting ourselves in this position as we're working, as we're doing things. So again, if this is a yucky motion, or if this is a yucky motion, something that increases the pain in your butt, then let me turn to the side here. What is the relative position of the hip to my trunk? Well, it's reduced. It's what we call a closed or an acute hip trunk angle. So we've got the hip, we've got the trunk, and it's a small little V. And so if that's yucky, what's the opposite of yucky? Yummy. What's the opposite of a closed hip trunk angle? An open hip trunk angle. This often shows up for people, this closed hip trunk angle, if, yes, they're crossing their legs, but oftentimes we're sitting in and we're working. So it's a little deceiving because we're not necessarily bringing our knee up to our chest when we're working, but instead we're bringing our trunk to our knee. And so we're closing down on that from above as we're involved in work, as we're writing things, as we're eating, as we're talking to people. This is oftentimes the way that we're working. We're leaning into our work instead of having the work lean into us. So what I want you to do is I want you to make a little tweak starting today. Scoot all the way back, use your back support. If you're able to lean back in your chair, that's awesome. And you're going to scoot in and then pull your work towards you. So now I'm sitting and I'm working in an open hip trunk angle versus the opposite, which is a closed hip trunk angle, which tends to provide more compression, more stretch in a way you just didn't know until I was maybe able to highlight it for you. Okay, so that's one little tweak or modification to the sitting that can help you not pick the scab and undo the positive effects of that exercise we just showed you. So go ahead and try this out. Let me know your thoughts below in the comments. And if you're watching this and you'd like other tips and tricks to learn how to heal your pain naturally, go ahead and check out the other videos. Thanks.